This is the last session. And then because there is a shuttle waiting outside at 17:30, so we need to be on time. I'm Professor Derek Chen from National Taiwan University, Beihou branch. And beside me is...
I am Huang Yijia from the Zhongshan Medical University.
So both of us are going to chair this session. And I think we're honored to have a very young assistant professor from Department of Food Science and Nutrition, the Hong Kong Polytechnic University in Hong Kong. And today, I think he's going to give us a talk on prospective association of the portfolio diet with all-cause mortality risk in the NSOS and Mr. Oz and Mrs. Oz study. And let's welcome Dr. Law.
Thank you very much for the introduction, and thank you the invitation from the organizing committee. I'm Dr. Kenneth Low from the Hong Kong Polytechnic University. So let me introduce a little bit more about my work in Hong Kong, analyzing the Mr. and Mrs. Oz osteoporosis study about portfolio diet. So I will talk about several things in today's talk. So firstly, what is a healthy dietary pattern? So we, for speakers in this 2 days conference, we have talked a lot about dietary patterns. So I will briefly mention that. And then what is portfolio diet? How it is being developed? And then how we gonna apply portfolio diet in the Chinese population? And what I see from the trend and the current dietary pattern research. So what will be the future steps that we can take? So just to go through some general background. So we are interested in doing nutrition research in response to all the non-communicable disease all around the world, because we can see that. So for the common NCDs, we have cardiovascular disease, cancers, lung disease, diabetes, etc., and that affect a huge population in the world, and that also increase the economic burden, both for the healthcare system as well as for the caregivers of the patients. So we can see that one of the primary risk factors for NCD is unhealthy diet. So right now, we're interested in how we can use nutrition to improve the health of the general population, so we can help to reduce the disease burden in long term. So just to show that, so in a more conventional point of view, so people are interested in different types of nutrients like omega-3 fatty acids, or the food groups like fruits and vegetable intake with the burden of disease, because it is relatively easier to quantify the association. Let's say we can say that having more omega-3 fatty acid intake can reduce the risk of CVD, maybe like 6% or like 8% from the meta-analysis or from primary studies. And we can also see that the dose-response relationship, let's say when having more fruits intake, it can also reduce the risk of cancer or maybe different types of cancer, lymphoma, etc. But those are the more conventional ways in doing nutrition epidemiological research. Because right now, rather than just focusing on individual nutrients or specific foods, people nowadays are more concerned about the dietary pattern, which is a broader picture of food and nutrient composition. So that may be more predictive of disease risk comparing to specific nutrients and foods. And we can also take advantage of those calculations that we can define the dietary patterns according to their food consumption, and then to calculate the diet-disease relationship. And when we talk about the intervention, so what we're gonna do for nutrition education, so it's not just like educating people to eat more fruits and vegetables, having more omega-3 fatty acids, but instead we can inform a shift in terms of their overall dietary habits. And therefore, we do see there are many intervention studies ongoing to show that how dietary pattern can do good to the cardiometabolic risk, rather than just focusing on supplementation with individual nutrients. So some well-established dietary pattern, not going to repeat it all the way again, but one of the most established dietary pattern would be Mediterranean diet. That is a dietary pattern that we have observed in the Mediterranean area. So from the pyramid, you can see that Mediterranean diet do focus on the whole grain food intake, the plant oil, which is the healthier oil source, fruits and vegetables, nuts and legumes, lean meat, some dairy products, limited red meat and butter, and also with moderate consumption of alcohol, and also added with daily exercise and weight control. And another very established dietary pattern would be the DASH diet, which is the dietary approaches to stop hypertension. So it is designed to normalize blood pressure levels in patients with hypertension. So you can also see the emphasis of fruits and vegetables and low-fat dairy products. And but you can also see there's some limitation on the saturated fat, red meat, sweets, and sugar, certain beverages, as well as lowering the intake of sodium, because sodium is one of the key determinants of blood pressure. So this is one of the dietary patterns that has been advocated for cardiovascular disease prevention. So we do share, they do share some similarities. Let's say emphasizing whole grains, fruits and vegetables, and discouraging sugary food or those salty foods. But for some other differences, let's say for Mediterranean diet, it encourages the consumption of fish as recommended intake of 2 or more servings per week, and emphasize the use of olive oil or the healthy oil source for food preparation. Also focus on consuming more fiber. And for DASH diet, so some nutrients, including potassium, magnesium, or calcium, will be emphasized because they are more closely related to blood pressure control, and has a more structured diet eating plan, as it recommends daily recommended servings for each food group. So because if you look into different dietary patterns, so some dietary patterns, they do have their recommended intake in terms of servings or grams. So it is relatively easy to be put into intervention studies. But for some dietary patterns, right now we're still seeing the evidence from prospective cohorts. And for the recommended intake, it has been derived from the data distribution. Let's say for those people with higher adherence to certain dietary pattern, and then maybe people would base on those cutoff points and to plan the dietary intervention. So those are different dietary patterns, and they have each of them has their progress in terms of translating the findings from observational studies to intervention studies. But what I would like to introduce for today's talk. So firstly, I would like to talk about the cholesterol management and CVD prevention first, because for the dietary pattern that I'm gonna introduce today, so it is aimed at reducing those cholesterol levels. Let's say for total cholesterol as well as LDL cholesterol. So those are the main cause of cardiovascular disease, and they serve as a good proxy, a good indicator to predict the risk of having heart disease. And also we have the evidence from the systematic review to say that a plant-based dietary pattern can significantly reduce the risk of cardiovascular death as well as the incidence of cardiovascular disease by 8 to 10%. And therefore, the plant-based diet has gained more and more interest. And that is how we come to the concept of portfolio diet. So what is a portfolio diet? So even for the Chinese name, 这个组合饮食法, well, we're not that certain what it is, but actually it is a plant-based dietary pattern developed in early 2000s, aiming to lower the LDL cholesterol. That is, in layman terms, the bad cholesterol, the indicator for cardiovascular disease. So we can see there are several key components in the portfolio diet that aim at reducing LDL cholesterol. Let's say nuts and seeds, plant protein, viscous fiber, plant sterols, as well as monounsaturated fatty acids. And later on, because we have more understanding on how saturated fat can increase LDL cholesterol. So later on, the limitation, the restriction of saturated fat is also being included in this dietary pattern. So the adherence to the portfolio diet. So later on, we will also calculate the portfolio diet score to see whether a better adherence to portfolio diet can reduce the chance of cardiovascular disease. And firstly, well, for a portfolio diet, the evidence comes from randomized control trial. So it is an interesting story because in contrast to some dietary patterns, so we firstly see the evidence from cohorts, from observational studies, and then we plan an intervention to test its effect. Actually, for portfolio diet, the evidence firstly come from the RCTs. It was originally being planned to reduce the cholesterol level for people with high blood lipid. And it has been developed earlier in the years by Professor David Jenkins from the University of Toronto. And you can see that from this meta-analysis of randomized control trial published back then in 2018, you can see that from those RCTs, well, for LDL cholesterol, so we can see a significant changes, significant improvements in terms of the level. And you can also see many of the parameters also show significant improvements. So from the forest plot, if those boxes, those bars, they don't touch the line in here, so that means that is a significant effect using portfolio diet to improve the levels of those risk factors. So LDL cholesterol, along with some other lipids or the blood pressure, etc., they do have the benefit. But the further questions that we want to ask is, so whether we can see those benefits in a population study. Because from the previous study, we mainly focus on a specific target, which is the people with a high blood cholesterol. But if we put into general population, what we will see. So that is how I started my collaboration with Professor David Jenkins, as well as the professor from the Brown University. So we come up with the idea, what about we calculate the adherence score to the portfolio diet and see whether it predicts the future disease risk. So for this paper, well, it was a collaboration between Brown University and the University of Toronto. And back then, I was a PhD candidate, and I worked with the team and to see whether the portfolio diet adherence relate to a lower risk of having diabetes. So you can see that this is how we present the results from Q1 to Q5. That means for Q5, that means for those people with the highest adherence to the portfolio diet, so they will have like a 13% of risk reduction comparing to those people in Q1. That means they have the lowest level of adherence to portfolio diet. And they have found that the risk of having having diabetes is relatively lower. And to further this work, so the first author, our collaborator, Dr. Andrea Glenn, so she has analyzed the data from the nurses' health study as well as the health professionals follow-up study. So for colleagues that are interested in nutrition epidemiology, we know that those cohorts are the are the most are the cohorts with the highest data quality, and therefore with those cohorts, while we can demonstrate the results that can be very likely to be translated into clinical guidelines. So from those studies, Andrew has found that the adherence to portfolio diet also reduced the risk of having cardiovascular disease, let's say for the coronary heart disease and stroke, and also have a better profile in terms of the blood lipid and also for the inflammatory biomarkers. So when you see like different kinds of like the inflammatory biomarkers, let's say for the interleukin or maybe the C-reactive protein, they also have shown a significant reduction. So from those papers, we have some preliminary findings saying that, well, portfolio diet is good for CVD or the diabetes prevention. But we also encounter a question, because for many of those dietary patterns, we firstly have the evidence from Western population. So when we do health education in the community, so we will encounter some concerns like, well, those Westerners, they have different diets. So how can we implement the diet into our daily lives? And therefore, when we want to translate the findings into local population, then for sure, we have to find some research evidence being conducted within the local community, then we can use it and to generate the findings that we can use it for future implementation. So that comes to the Mr. and Mrs. Osteoporosis study. So that is a cohort study to examine the determinants of fractures in older Chinese men and women. So it is actually a part of a large-scale multi-ethnic study, included the population from Hong Kong, Sweden, and USA. But for our data, we use 2,000 Chinese men and 2,000 Chinese women aged 65 years or above. Back then, like 20 years ago. And you can see that over the past 20 years, so Mr. and Mrs. Osteoporosis study, the OS study in brief, has resulted into over 150 publications with in more than 20 research areas, including like fractures, osteoporosis, bone imaging, frailty, sarcopenia, etc., etc. Because along with the dietary information, as well as other lifestyle information, and as well as some blood biomarkers, so we're interested in all different types of diseases related to older adults, not only for cardiovascular disease that we will discuss today, but also about the changes in muscle health, in bone health, in their condition, etc., etc. So that is one of the best cohorts in Hong Kong that we used to examine the dietary determinants to healthy aging. So for the current study, so I have included close to 4,000 participants. We have excluded 9 with missing data. So you can see the missing data is only very few in this cohort. And we also stratify the analysis according to sets and to see whether the association differ by sets. And we see that for male participants, they tend to have more dietary energy, lower BMI, higher physical activity, lower blood pressure, and also have high consumption in several components of portfolio diet. And they also have different prevalence in terms of the comorbidity, being a smoker or alcohol drinker, as well as the education level. That is what we have found. Okay, so let me elaborate a little bit more about the portfolio diet score, because people may think that, so how are we going to calculate the portfolio diet score after we have the evidence from the randomized control trial? So that is what we have done. So firstly, from the literature, so for portfolio diets, they do have different components: plant protein, nuts, viscous fiber, phytosterols, and monounsaturated fat, as well as the limitation on saturated fats or cholesterol. So for the OS study, so we have administrated a FFQ at baseline with over 200 items. So it's somewhat like the reason that we do the dietary assessment at baseline only, because later on in the cohort, it will be too big of a burden for our participants to administer the FFQ again. But those are the pros and cons. But because the good thing is with a very comprehensive FFQ, so we can use it to calculate different types of dietary pattern. So in the previous years, so we have published papers not only for portfolio diets, but let's say for Mediterranean diet, DASH diets, MIND diets, etc., etc. So with that, we can calculate the adherence to different dietary pattern. And for the portfolio diet, we categorize the food into different components, and then based on the data distribution, and then we classify those subjects into quintiles. That means put them into 5 equal categories. So let's say which one has the top 20% of consumption, which one has the lowest 20% of consumption, and then we assign the points to each quintile of foods recommended or for foods not recommended. So we use the reverse scoring or whatnot to calculate the score, and then that will come up with a score range from 6 to 30. So that is how we calculate the score reflecting the portfolio diet adherence. So just to show you some culturally adaptation. So let's say for the plant protein, what are the examples? So those are the local foods that we select from our FFQ. So that is how our subjects have consumed their plant protein. So similarly, for the viscous fiber, so that means being a little bit sticky. So you can imagine that after cooking those food, so when we eat them, so we see a little bit of stickiness in them. So this is the example of viscous fiber. And for saturated fat, we also have the local food items. Those are the items available in our FFQ. And then in our nutrition analysis software, we use the food processor for analysis. So if we have encountered some local food, so if necessary, we also create the food code that contains the nutrient data. So we can do the dietary analysis for the local population. Okay, so those are the main results. So firstly, having the highest adherence to the portfolio diet, so that helped to reduce the risk of all-cause mortality and cancer mortality. And when we stratify the results by sex, so the significant association was found among males. So we also see the lower risk of all-cause and cancer mortality. And but for females, so the association is relatively weaker. And then we also break down the categories according to the components. Let's say we have 6 components for portfolio diet. So we can also see that for high consumption of plant-based protein sources, viscous fiber, and nuts, so that also relate to lower chance of mortality among males, as well as the relationship between plant protein and lower risk of CVD mortality among males. But the association may not be that significant among females. And when we do the sensitivity analysis, we exclude the people according to each of their comorbidity and do different types of sensitivity analysis. So long story short, the results remain similar. So mainly we've observed significant findings for portfolio diets in reducing the risk of all-cause and cancer mortality, mainly among males. And we also do the competing risk analysis. So what that means? That means because throughout the cohort, so some people may develop cardiovascular disease first, some may develop cancer first. So that refers to the concept of competing risk. So we also put that in consideration. But the result is also similar. We also see the inverse association with cancer mortality among males. So this is the summary of our finding. We have, firstly, it is the first prospective cohort to examine portfolio diet and mortality in Asian population. We see a significant lower risk of all-cause and cancer mortality for those people adhering to portfolio diet, especially for male participants. And when we look into individual food components, so plant protein may play a bigger role in reducing the risk of cardiovascular mortality. So how we gonna explain? So maybe the result is being attributed by the consumption in plant protein, viscous fiber, and nuts. Maybe because those males participants, they do consume more food components related to the portfolio diet. So that is why we see those protective effect. So that is what we see from this study. But after seeing the findings from this study, while on one hand we see the portfolio diet is doing good for the Hong Kong population, we have to acknowledge the limitation of the dietary pattern analysis. So firstly, we see that there are different types of dietary components within a dietary pattern. So actually, which one is more important than the others? So we have to use a more quantitative approach to answer that. But this is an area that we visit less often in the previous studies. So we do need some other approaches to examine, like in addition to the conventional methods like cost proportional hazard regression or the logistic regression, how we can adjust for those interrelationship between the dietary factors. So in the last part of my today's presentation, just want to briefly go through another paper that I published using the OS study. So this is the joint food group analysis that our research group has done using the quantile GCG computation. So actually, this is a research method that we see from air pollution research, because they also encounter the problem of having intercorrelated exposure. And using this, we can quantify the relative importance of each food within the complex of a dietary pattern or the dietary exposure. So we see that the high-fat milk, so this is the positive association, so relatively higher contribution to the risk of death. And then we see that for inverse association, so whole grain is relatively more important in reducing the risk of death. And lastly, we also observe the joint effect of all these kind of food groups on the risk of all-cause mortality. So that is the relatively newer approach to address those problems. So some take-home messages, we see that we have more and more evidence showing that dietary pattern may be more beneficial than individual foods or dietary supplements to prevent chronic disease. So we have demonstrated that using portfolio diet, a LDL cholesterol lowering dietary pattern, it may help to reduce the risk of all cause as well as cancer mortality. But we do need more sophisticated studies to account for all these kinds of like the relatively weight gain of each food group within the context of a dietary pattern. So that will help to strengthen the research findings from the conventional analytical approach. And lastly, to acknowledge my collaborators, including Professor Jin Wu from the Chinese University of Hong Kong. It's my pleasure to be within her research group that I can learn a lot in terms of geriatric nutrition research. And Professor David Jenkins, so he is the advocate of the portfolio diet. So that is why we do have the chance to look into portfolio diet in Asian population. And my mentor, Professor Simon Liu, and also my collaborators in the Chinese University of Hong Kong. And this is such the photos that we have met in different conferences all around the world. So those are the references. So I'm glad to receive any questions during the Q&A sessions. Thank you very much.
Thanks, Professor Low.
Okay, since we will put a Q&A in the end of the session, so we will move to the second speech.